How's it going, guys? Past level question for pulmonary for step one. 60-year-old man. He's got X-ray CT showing supradiaphragmatic pleural soft tissue densities, vitals laboratory tests normal, and spirometry showing us a restrictive lung pattern. Your lung volumes are decreased. Your FEV1 or FVC is normal/increased. That's restrictive. For obstructive, you're going to have increased lung volumes, and you're going to have a decreased FEV1 over FVC. If you're confused about all the lung volume stuff, go to my pulmonary PDF, which I've linked below. I have charts, tables, all that stuff on all the lung volumes. Okay, it's near the beginning of the PDF as well. Clear all that stuff up for you, very easy. Which phonecyte we see in this patient? Choice A, shell calcifications, wrong fucking answer for silicosis. Patients who've worked in foundries, those are metal workers, as well as stone quarries. And it's pretty low yield for USMLE actually, okay? But you've probably heard this from Qbank somewhere. I mentioned it in my PDFs, but you need to be aware of silicosis as a pneumoconiosis differential. But what I can tell you is that there's increased risk of tuberculosis infections, something about impeding the phagocytosis of TB, and you want to avoid anti-TNF alpha agents in these patients because anti-TNF alpha agents can increase the risk of TB. Silicosis, wrong fucking answer. Choice B, ferruginous bodies, correct answer. Very buzzy, pathologic descriptor for asbestosis, and you're going to get these pathognomonic, supradiaphragmatic, and pleural plaques. That's what I want you to know. USMLE can write them as soft tissue densities. Holy shit. Same thing. I mean, this is past level. You got to know that this is asbestosis. Look at my PDF. I've written it right there. Okay, and it's going to be patients who worked in construction, shipyard workers, and it often develops decades after they were exposed to it. And it's a precursor to mesothelioma. So mesothelioma is going to appear, malignancy will appear as a white rind circumferentially around the lungs. Very interesting, gross path specimen. And they'll give you an image of the mesothelioma and then ask you what cell is fucked up, and the answer is mesothelial cell. I mean, it sounds obvious, but this is what the NBME will do. And you can get restrictive or obstructive lung patterns with asbestosis. USMLE doesn't give a fuck, okay? It's usually restrictive. You don't have to worry so much about the lung volumes necessarily for the pneumoconioses. Where the lung volumes really matter are knowing, for instance, that COPD, asthma, those are obstructive, or that interstitial fibrosis, if they tell you, that's going to be restrictive. So is asbestosis. Let's just hop through the, and ferruginous bodies are these brownish appearing dumbbell structures in the lungs on light microscopy. And they want you to know macrophages are going to attempt to phagocytose the asbestos fibers, and then the fibers will become laden or covered with iron, and that's where they get the name from. And if they show you a light microscopy of ferruginous bodies and they ask you what cell is responsible for pulmonary fibrosis in this patient, the answer is going to be macrophage. Okay, I've also covered that in my PDFs. Let's just hop through the other answer choices here. Granulomas, wrong fucking answer. So caseating granulomas can be tuberculosis. Non-caseating granulomas can be berylliosis, sarcoidosis. Okay, so they can give you a big paragraph, tell you there's no granulomatous inflammation, then you can eliminate berylliosis and sarcoidosis. So berylliosis, pneumoconiosis, associated patients who worked in the aeronautical industry, airplanes, spaceships, and it can be granulomatous. I mean, there's really like nothing else to, I mean, when we talk about like silicosis, berylliosis, they're pneumoconiosis differentials, as I said, you should be aware of, but not exceedingly high yield for USMLE. For granulomas, it's really sarcoidosis, big lengthy digression there, but that's where that really factors into the lungs, okay? Granulomas, wrong fucking answer. Choice D, Mallory, hyaline, wrong fucking answer. So just Sibian asshole. It's not even related to pulmonary, as far as I'm aware. Okay, this is for alcoholic cirrhosis, just alcoholism in general. They'll give you an alcoholic and they'll say what's most likely to be found in the liver in this patient. Answer is Mallory, hyaline. You're like, what the fuck? Never heard of that before. It's like, yeah, I mean, I don't really know what to say. It's just a path descriptor you should know for USMLE. It's asked on the NBME exam. Okay, so you just get deposition of Mallory, hyaline in the liver with alcoholism. Don't really know what to tell you. Wrong fucking answer. So I see read index greater than 0.5, wrong fucking answer for COPD. Specifically chronic bronchitis. Okay, so chronic bronchitis, read index is measuring the thickness of the mucosal layer in relation to the entire thickness of the airway. And greater than 0.5 in chronic bronchitis, because chronic bronchitis is when you have a productive cough greater than 3 months in the year for at least 2 consecutive years, and you have copious mucus production. Okay, so this copious mucus production, this leads to the whole hypoxic vasoconstriction, blue bloater, increased afterload on the right ventricle with pulmonary hypertension, cor pulmonale. So, but you got to know for USMLE, read index greater than 0.5, it's chronic bronchitis. Clearly, that would be obstructive lung disease, not restrictive. You're not going to get these pleural and supradiaphragmatic plaques. Read index, wrong fucking answer. You know the deal. Once you make more content, like my subscribe. Appreciate your time. That's it.